Hi, my dear colleagues. Now we are treating with the Pluryal range of products, a wonderful lady here, where we will treat and focus on the midface. So everything you see here is the areas where we want to treat. So we will work on the deep and the superficial fat compartments. So we've done all the drawings, and we'll also tell you about those drawings more in the therapy. So this wonderful lady is taking Xarelto, which means she stopped taking Xarelto 48 hours before the treatment, and she will restart the day after tomorrow. So I think it's something which is very interesting and important for you, because more and more people taking these medicaments. It's also important to know how to work with patients who are taking those medicaments. So welcome to the Pluryal Academy, and I hope you will have fun and you get some new ideas with our workshop together with Mathieu Stefanelli, my wonderful friend and anatomist and plastic surgeon. So I'm Thomas Rappl, plastic surgeon from Austria, and we'll meet today in our office in Graz. Not live, in person, but you will see everything you need to have for your office. Welcome. Well, we will start from the top to the bottom, because it's important almost, if you make a whole facial treatment, to stop from the top going downwards, because every tiny injection in the upper part will make some slight changes in the lower part, which means if you start from here, probably you're going in the wrong direction. You need lots more of volume than if you go from upwards to downwards. And you will see that any tiny movement you have in this area will change a little step downwards. So although we start with the midface, we will start nevertheless doing a little bit for the temples, because also if you take a movement here, you see the movement in the lower area of the midface. So if you want to treat the midface, you also have to treat the deep temporal fat pad or the superficial temporal fat pad. For the safety areas, you have to take in account that you have, of course, the vascular supply of the face coming from the facial artery, running here into the angular artery, giving a branch to the inferior and superior labial artery, running most of the cases in over 60% along the nasolabial folds. Then it gives a branch to the tip of the nose. Then the angular artery runs up and gives a branch to the dorsal artery. Then goes up supratrochlear artery and gives a branch into the orbit. This is the risky area, as you all know. Be careful in the area of the nasolabial folds. Be very careful in the area of the frown lines, and then you have the supratrochlear and supraorbital area. Then we go for the fat pads. You have the lateral SUV, you have the medial SUV, you have the piriform fat pad, you have the nasolabial fat pad, then you have the deep medial cheek fat and the deep lateral cheek fat. It's important to work on the deep compartments, because this is the compartment where it's losing over time the volume. You also can work on the more superficial fats here, and there you have, of course, to take another filler with another viscosity properties, which should be lower G prime, because you want to work on the fine lines and wrinkles. Lachmar, smile. Okay, so relax. So you want to also work on this to diminish those fine lines. So you see the safety areas, and now we go for the treatment. Okay. To start with, there are different approaches to go to the temporal area. So one approach is to go directly on the deep temporal fascia and place your volume there. You can go from the temporal crest downwards, or you go from the zygoma, like you see here, opening the channel with the needle and go with the cannula over the deep temporal fat pad in this area and going to the lateral SUV in this area. So we will make the pre-hole. Stop. Okay. This is Pluryal volume, and I go up a little bit of stretching, and almost it's important to take a smooth movement, making your way up and letting the cannula float in. And then you're sure, because you can't penetrate the deep temporal fascia because it's such a thick fascia. And then you're doing a slow injection with the Pluryal volume, staying over the deep temporal fascia. And you see how easy it fills in. And this is a space where you also can squeeze in the material. So also, if you're going directly perpendicular with the needle, you could easily squeeze the volume into the plane. Now you see a little bump. You take your thumb or your finger, make a tiny massage to spread it out into the space between the superficial and the deep temporal fascia. For the medial SUV and the teardrop deformity, therefore we make a tiny little pinch here and open up for the next cannula pathway. And also it is important to go in contact. You have to be deep, almost deep, just touching the bone, and also bending the cannula that it dives down into the deep compartment of the SUV. With the Pluryal contour, does not need much gits. Mm-hmm. And I'm now with the cannula here in the middle. Try to dive down into the medial part, and now you see I'm very, very deep. The dip is quite deep on the orbital rim, where I can place my very tiny little amount of 0.1 of Pluryal contour. Okay, if everything is fine, so you have to be on the orbital rim, and coming from this direction, you don't pass into the deep septum. The next thing is where we want to work on the fossa canina and on the nasolabial folds. Now we go for the nasolabial. So it's important to know that you have two options to be safe. One is to go perpendicular with the needle downwards to the piriformis area. The other one is to make a pre-hole in this area where I can easily work for the nasolabial folds going down to the fossa pyramidis, and also work on the marionette lines. This will be the way what we will be doing. Go. Okay, now we go 2 centimeters lateral from the mondiolus. We make our punch in this area. Stop. And then easily from this approach, there, going very, very slowly. And you almost have to look at the patient if there's a lot of bleeding or swelling, or also if you have a blanching effect. And slowly, and you bend your cannula, and you let the cannula dive down into the fossa canina. 1 and 2. If you want to stay more superficial, going into the deep dermis, you bend your cannula like that, so it goes up more superficial. And the last one, you take the same approach. You turn your cannula, and you can reach easily the area of the marionette lines and also go into the lip area. So we will take 0.5 for the marionette lines, and then we could also do the lips from this approach. The last area to treat are the superficial fat compartments, which are quite easy because you go from this direction, from the mandibular angle, and you want with the cannula to reach all this approach to work on the more superficial fat pads, which are giving, if you treat them, giving more improvement for this area and giving a smooth transition. Also, therefore, the same approach. And just make your pre-hole. You pinch the skin. And then it's good to stretch a little bit the skin, and you're giving tiny amounts by antegrade and retrograde injection. So almost keep it stretched. And this is a double effect. The effect of the cannula, which gives also a regenerative process. And the other thing is that you give your hyaluronic acid into the places where it's been lost over the years. Okay. Oh, that comes a bit more. Okay. Massage. So the first side was the really safe approach with the cannula. But sometimes you're also aware of using the needle. And now I show you how to be safe also, or safer than you used to be, also by using a needle. There you have to obey some principles. So my approach is, normally if I want to be really on the safe side, I do a sonography beforehand, I do the cannula treatment, and try to work the whole face with the cannula. But now, sometimes you have to knead the needle, or you want to knead the needle because you're more comfortable with it, but you have to obey those principles of safety. So we also start for the temporal area. As you know, you have the one-shot technique. So in the old textbooks you hear that you should go down to the bone, which is not true, because you have the deep temporal fascia, and if you stay over the deep temporal fascia, it's not easy. You have to be a very, very experienced injector. The first one is also to palpate the frontal branch of the superficial temporal artery. And if you know that you're safe, then you have the temporal crest, you have the zygoma, and you see those sunken spaces. As you see on the other side, I could work easily with the cannula the whole space, but what I do with the needle is I touch, I go slightly downwards, and I let the needle go in like very tiny movements, and suddenly you feel a resistance. The deep temporal fascia is quite a thick fascia. If you feel this resistance, you make your injection there, and you will see in the right plane the whole substance spreads out evenly in the temporal fossa over the deep temporal fascia. So it goes easily in. You see no bruising, nothing else, and you have a little bolus here, and then you make a tiny massage, and you will spread out the substance easily in the area between the superficial and the deep temporal fascia. Okay, now we take the next one, the Pluryal contour. You see the zygoma, and this is also the needle technique, so pretty much the same. You have what bolus techniques where you go very deep with your injection. Therefore, you have the first one where you draw a line from the tail of the eyebrow down to the corner of the mouth, like this, and from the tragus to the ala, like this. So in the crossing point of those two lines, you're exactly over the zygoma, which is the sweet spot. The sweet spot means the same as the lateral souff area and also the eminence of the zygoma. You go down to the bone, almost take a look on your patient, and then with a tiny injection of 0.2, you replace the missing volume in this area. Lateral, the same for the medial SUV. And on the orbital rim, I mark the orbital rim here. Almost keep your finger on the eye that your product doesn't get over the orbital rim. You're in touch with the orbital rim. This does not need much, just 0.1, 0.2 cc of a contour product, which doesn't attract that much edema. Okay. To be safe for the nasolabial folds is, again, to go very deep, because never forget you have the angular artery here. You want to work on the fossa pyramids or on the fossa canina, which means going downwards, let easily the cannula slow in and glide in, or it's a needle in this case, and then you make your injection point there. Everything what I do is smooth. There's no hurry. It's almost to be very safe. The same if you want to stay for the nasolabial folds with a needle. You come from a lateral approach, because at least the worst thing what can happen is that you puncture the artery. But if you stay in the deep dermis, you see I'm very superficial, placing your substance there. Almost keeping an eye if there's a blanching effect, then you don't lose a lot of volume there. The same approach for the marionette lines, and also going into the corner of the mouth. The same approach as has been before. You draw a line lateral 2 centimeters of the modulus, the corner of the mouth. You keep it very superficial, almost keep an eye on the patient, slowly injecting for the corner, and then coming from downwards, because you have the artery there, and working on the marionette lines. Okay. Still approach for the superficial treatment of the skin. So I prefer to work with the cannula in this area, so you're going over the masseter muscle, so this is also a safe zone. You're making your pre-hole for the cannula, and then you go in, treating the area with a low G prime product, making a fanning technique, staying superficial, let the cannula slide in.
Stoppen, gell?
Ja, warte. So, sieht man das?
Mhm.
Stretching the skin. Okay. Well, now it's time to summarize everything. We used a 22 gauge cannula and a 25 gauge needle. So left side cannula, right side needle. We started with a temporal treatment with Pluryal volume, 0.5 cc each side. Then we proceeded to the cheek area and the midface area, where we had Pluryal contour. Each side with the lateral SUV 0.2 cc, medial SUV 0.2 cc, nasolabial folds 0.3 cc, and marionette lines 0.3 cc. The same Pluryal contour on the other side. Then we went to the tear trough area, where we had with the Pluryal classic 0.2 each side. And to end off everything, we also proceeded for the lips just to give overall improvement of the face, because it's also important. There we took the Pluryal Classic for the lips, upper and lower lid, 1 cc for the upper lid, 1 cc for the lower lip. So I hope you had fun, I hope it was informative, and I hope you will be educated very well for your patients. And thank you very much for joining the Pluryal Academy and the Pluryal workshop with Mathieu Stefanelli and with me from Mara Aesthetic Research Academy. Thank you very much.